Dr. Bill Adams here, and this is No Spin Live, and we have a show for you today because we're going to talk about the lighter side of COVID-19, and we've got 4 incredible plastic surgeons to talk to you. We got Dr. Brad Calobrace from Louisville, Kentucky. Brad?
Hey.
No Kentucky Derby this year, right?
No, not now. In September, actually,
Okay.
in September.
Postponed. And then we have our expert Austin contingent, Dr. Ashley Gordon.
Hey, guys.
Dr. Dustin Reid, the partnership, Ashley and Dustin, and Dr. Ned Snyder, all from Austin, Texas.
Howdy.
Ned, how are you?
I'm good. I'm great.
What's that behind you?
Oh, I'm sitting in my dining room.
The blue
Got to get
dog
away from the
Yeah,
kids
he's
and the noise. at the
he's
end of my
honoring
dining
New
table.
Orleans.
representing
Yeah.
NOLA.
I think
That's
the
right.
South is well represented today on the show.
That's right.
All right, well, so we're going to talk about something a little bit more lighthearted. Brad, you start off, but, there's people have a lot more time. We're all probably busy doing various things. Like we're just talking, Brad, that we're on these chats all day long, charging our phone 5 times a day. But
Yeah.
give us a lighthearted story. Everybody's going to come up with a kind of lighthearted story. What are they doing in the past time? Something that's been kind of funny over the past week or 10 days. So, Brad, you start off.
Okay, well, I will tell you, I think you guys can see from the halo that's around my head here that I'm doing all things angelic and great and fantastic because I'm cooking at home every night, which I don't ever do. Like we eat out every night because we're all so busy as surgeons. And so, I think I've just taken the opportunity. I've been busy with all of these people and a lot of people around the country and around the world, figuring things out and all talking together and trying to understand. But at the same time, I've never been home this much in my life. And so I'm being really productive and I'm doing normal home things. And I was saying today, my yard people were here and I was talking to them and, seeing what was going on. So I think it's been, for me, a really fun, unique time. I cook every night. I take pictures of everything I cook because I'm so proud of it. Tonight is pasta fagioli. For anybody that knows, I'm Italian. And so, I think it's sad. I say, I can't change the reality that's in front of me. So all I can do is really just try to, embrace whatever positive things I can bring out of this period of time that we aren't doing surgery and not seeing patients.
Yeah, well, that's I need to come over and have. If I was closer, I'd like to come over and have that.
You'd be invited.
That sounds awesome. Yeah. All right, Ashley, how about you?
Yeah.
What kind of story you got for us?
Same thing. I have not been cooking because my husband is actually the cook. He's an oral surgeon. So same thing. His practice is pretty much shut down except for major emergencies.
Also
he's been-
Italian, I might add.
Also
Oh, yeah.
Italian.
I know him.
Yeah,
Mhm.
you know him. So he's been doing all the cooking and I've been doing all the digging deep in the wine cellar and popping awesome bottles of wine because it might just be the end. And you just never know.
Wow.
Who knows?
Exactly.
Ashley,
Well,
So-
it's definitely the end of your sobriety for sure.
It's definitely the end of my sobriety because between the CARES Act and PPP and trying to figure out how we're going to keep our business afloat as this keeps getting pushed further and further back, there's a lot of wine going on at nighttime.
did
and
you
then I think the other-
Whining and wine.
Yes. And the other positive thing is Dr. Reid and I started this practice, 14 years ago, 15 years ago. He started 15, 16 years ago. And we've gotten so busy in the last couple of years that we really have very little time to really connect and really it's just like go, 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 go all the time. And I think like this adversity has really forced us to kind of get back to the bones of the practice and get back to each other and just like figure it out again. So that's been nice and fun. His
Sure.
partner says that it's dangerous when we're bored and we're together because we get into trouble.
All right, Dustin. So, tell us a story.
Well, I have a couple things to say. The last
Shocker.
the last part of Ashley's reminds me of why we had to put a lock on our gate. I have seen our landscaper, but he happens to have become a personal friend. He's been my landscaper since I moved here in 2005. I've watched him get married and have kids. He was a dreamer, so he was one of the people that got to stay here when that legal action took place, and he's a great guy. As far as what I've been doing during the day, as Dr. Gordon alluded to, we spend a lot of time texting, calling on these message groups that you're talking about. And then I've gotten even closer with my dogs. I take them on walks a couple times a day. My husband, Bobby's at home all day. He works out about 5 times a day because he's the kind of person who cannot sit. And this is going to be a real problem as this goes on longer. And then I usually don't drink during the week because I think I like to have a sharp edge, and now that I don't care if the edge is that sharp, so I've been dulling it each night, and then texting with Dr. Gordon again. And her texts at night are infinitely more entertaining than her texts during the day because they're after she started into this wine cellar. So that's what I've been up to.
I
I also got the pool open and ready to go, heated up to 90 degrees, so I can just get in it whenever I want.
That's awesome. Ned, how about you?
Well, it sounds like everybody else has been having a lot of fun. Not that we haven't. We're kind of on an extended spring break, and yeah, digging deep in the wine cellar and some of those things, and cooking real meals. Smoked a big brisket on Sunday, but we're about we're about a week or something into homeschooling. So anybody who's homeschooling knows what I'm talking about. That it's a workout. We've got an 8-year-old, a 10-year-old, and a 12-year-old. 12-year-old self-sufficient, but 8-year-old definitely not so much, and the 10-year-old somewhere in between.
Really, that's surprising because I would think the girls would be easier and Cinco would be the hardest.
They've got in 6th grade, he's got a pretty structured curriculum. So he logs in the morning and does Zoom classroom for the morning. So it's a real
School.
A real school sort of, at least for part of the day. He's given some homework assignments and kind of gets that stuff done in the afternoon on his own. But the girls, it's sort of like you just go through and pull out some pages out of some workbooks and work on this, or pull something up on an iPad or computer and do this for this morning. Time to read for an hour or whatever that is. And then you got to get them outside and run them like hell. Otherwise he's got too much energy at night.
Yeah. I saw something on social media that said, not to brag, but what a time to be childless.
I know. I thought when all this started, I was like, oh, there's going to be like a surge of deliveries, and all these people are going to have kids in 9 months because people are just home and everybody's going to be having sex. But then I think people started homeschooling their kids, and they're like, oh, hell no.
Yeah.
No kids.
It can't be birth control. Birth control for sure.
My son showed me a meme that said something to the effect of, in 20 years, think of what your leaders will be. They were homeschooled by alcoholic parents. Or something to that.
Perfect.
Yeah.
Well, Brad, I wanted to end up with you because we were talking about this before we started, but there are some patients that are coming in to plastic surgery offices because they're essential visits. That may be post-operative patients from a couple weeks ago or what have you. But I think sometimes people see different things and but they get concerned, like precautions that are being taken. Maybe you can just kind of speak to that a little bit. What kinds of things are you doing, or a lot of surgeons are doing as patients are coming in for essential visits?
Yeah, I was in the office yesterday seeing some of my post-op patients, and I'm, that's thinning out as time goes on, just essential visits. But even when we start back up, when this is all over, it's not going to be completely all over at all. So we need to always be adherent to a lot of things we started before we all sort of had to close down our practices and stop doing elective surgery. And things we started doing in the practice, of course, was scheduling more separation between patients. So nobody was ever sitting in the waiting room, and people were not really crossing paths too much to observe social distancing. We also have a questionnaire when they come in that asks, have you been traveling in quarantine? Have you had fevers? We take everybody's temperature when they're coming in to make sure they don't have a fever. Maybe they're not aware of. That may be a heralding sign that something is actually going on. Definitely checking for symptoms. And then we likewise clean every room thoroughly between every patient. We keep a distance. We, of course, always use gloves, wash our hands constantly, and use antiseptics as well. And then once a week in my office, we actually do a 360-degree stereotactic type of spray throughout the entire facility that actually goes from the ceiling to the floor to sort of sterilize everything. And it sticks on the surfaces and holds on there for up to 7 days. So it's sort of very similar to what they do on airplanes and stuff, just trying to do anything we can to reduce any contamination that may be present within the facility. I think it goes back to what we've always said forever, that it's so important to really use a qualified physician and a surgeon that's board certified that's going to take all the precautions and never cut corners as it relates to the health and safety of our patients. We all spent many years training and spending our time committed to patients' welfare and care, and so that doesn't change now. And so we step up and do all the extra maneuvers to make sure that our patients are safe.
And I think, Dustin and Ashley and Ned, you guys run centers too. And I think the one thing patients, maybe don't know, but there's a thing called universal precautions that we've all been doing for many years, and most people that are based and trained like we are, that's just kind of natural. So we're doing that, plus probably even doing even a little bit more, and just making sure these protocols are being followed. But I think patients should be rest assured that a lot of these things are things that we've always done, and they're standard things to basically minimize the transmission of any kind of infectious disease.
It's absolutely true. I mean, it's something that every plastic surgeon's office does to a large degree at this point in time. We have to do some additional measures that we didn't used to do, like Brad mentioned, taking patients' temperatures, and we do it actually before they even get in the office. We got a table set up outside the office and do it before they enter. Everybody in the office wears a mask when there's patients there, so all the interactions are done with masks on, which sort of seems impersonal, but it's it's what our recommendations are right now, so we're following all those things.
Yeah, and the universal precautions that we always follow, I think that patients do know that's going on all the time. It's the upfront stuff now that you're seeing, the specific interpersonal spacing that is not universal precautions typically, that makes everything seem maybe a little scary to them, but it's unique to this specific situation. A staph infection, you're not going to get it from somebody coughing into your face per se, whereas this is how you will do this. So yeah, I think that we're not really being specifically that much cleaner, because we're pretty retentive about that, anal retentive about that around here, but we are showing it more to make the people feel more comfortable. That would be the perfect time to.
Yeah.
We took all of our magazines off of the tables, things that people pick up. We don't let them get their own coffee and things like that. We bring them a cup of coffee. So there are things that we don't typically do that we've added to our sort of protocols.
But that's
we have people calling from the
situation, not something that we'll have to continue after.
Yeah.
Right. And will we have to continue it after, because we know,
for a while.
we're gonna for sure.
This is
like for a term. We have people calling from the parking deck when they arrive, letting them know if the room's ready to come in, like Brad said, so they're not waiting in the reception area, they're not waiting in the hall. They know when they come up, there's a room ready. And I think people really like that, because they're not waiting. And like the virtual consults and the virtual follow-ups have really helped, because they're also not waiting there too. So I think this is definitely going to change a huge part of how we practice, for better or worse, because I think patients are enjoying kind of these parts of, there are some positive things that I think are going to come out of this.
Yeah, probably have to continue until Dustin invents the treatment and Ned invents the vaccine. So then we'll be back to totally normal. So it's going to be great.
All right, I want the serological test.
Yes.
That is the teeter that shows if you have the antibody. Because Dr. Gordon and I are both pretty convinced that we had it back when this was in the beginning, and we did
like 5 weeks
ago. I went on a cruise. She went to New York City. We both came home sicker than dogs. Yeah. But there's no proof, so we have to do like everyone.
Yeah, that's right. Well, that antibody test will be out, but I would bet you, I'll bet everybody on there $20 that you guys both did have it.
Yeah.
I know. I think that
antibody test will pay up.
It was well before that. One thing for sure for all of our patients out there, we're going to come back rested, and it's be a great time to have treatments and therapies. All of your plastic surgeons and all your providers are all going to be super rested and super energized and wanting to be mostly with patients and not at home anymore. So we're going to
we'll be out of wine.
Yeah, long hours and rearing to go. So
we'll be fit because we're exercising more than ever. There's a lot of positives coming out of that.
Yeah, exactly.
All right. Well, listen, full throttle, guys, and just remember, keep a cool mind, warm heart, and clean hands. All right.
Absolutely. Thank you, everybody.
Thanks, everyone.